Pathology. Tongue hemangiomas are benign vascular tumors characterized by proliferating blood vessels. Histologically, they are classified as capillary small, tightly packed vessels or cavernous large, dilated vessels with thin walls. The endothelial lining is flat and non-atypical, embedded in a fibrous or myxoid stroma. Grossly, they appear as red-blue, compressible masses, often well-circumscribed but unencapsulated. Immunohistochemistry, IHC endothelial markers, CD31, CD34, factor VIII, confirm vascular origin. GLUT1 is positive in infantile hemangiomas, but negative in congenital variants. D2-4D lymphatic marker helps exclude lymphangioma. Low-key 67 reflects benignity, distinguishing it from angiosarcoma. ERG/FLI1 may also be used to highlight endothelial nuclei. IHC aids in differentiating hemangiomas from malignant or lymphatic lesions. Epidemiology studies the distribution, patterns, and determinants of diseases in populations. It identifies risk factors, disease prevalence, and outbreaks, aiding in public health planning and prevention strategies. Clinical presentation refers to the signs, symptoms, and medical history associated with a disease. It varies based on disease type, severity, and individual patient factors. Accurate epidemiological data and clinical assessment are crucial for early diagnosis, effective treatment, and disease control. Together, they help in understanding disease burden, predicting trends, and implementing targeted interventions to reduce morbidity and mortality in communities. Capillary, cavernous, and mixed types are histopathological variants of vascular lesions. Capillary hemangiomas consist of closely packed, thin-walled capillaries lined by endothelial cells. Cavernous hemangiomas feature large, dilated vascular spaces filled with blood, separated by fibrous connective tissue. Mixed hemangiomas exhibit both capillary and cavernous components, combining small and large vascular channels. These differences influence clinical behavior, with capillary types often regressing and cavernous types persisting or causing complications due to their size and depth. Immunohistochemical markers, CD31 and CD34, are endothelial cell markers used to identify vascular tumors and angiogenesis. CD31 is highly specific for blood vessel endothelial cells, aiding in diagnosing vascular neoplasms. CD34 marks hematopoietic progenitor cells and vascular endothelium, distinguishing vascular from non-vascular tumors. D2-40 potoplanin is a lymphatic endothelial marker, useful for identifying lymphatic origin tumors and differentiating vascular lesions. These markers help in diagnosing and classifying vascular and lymphatic tumors accurately. Differential diagnosis: lymphangiomas, granuloma pyogenicum, and other vascular malformations. Lymphangiomas are benign lymphatic malformations with thin-walled, endothelial-lined cystic spaces, commonly found in the head, neck, and axilla. Granuloma pyogenicum, pyogenic granuloma, is a lobular capillary hemangioma presenting as a rapidly growing, red, friable lesion, often triggered by trauma or hormonal changes. Other vascular malformations, such as arteriovenous malformations and venous malformations, differ by their lack of endothelial proliferation and persistence from birth. Histopathology and immunohistochemical markers aid in differentiation, management, and prognosis. 1. Observation asterisk. Small, asymptomatic vascular lesions, e.g., some capillary hemangiomas, may regress spontaneously, especially in infants. Regular follow-up ensures monitoring for complications like ulceration, bleeding, or rapid growth. 2. Laser therapy asterisk. Used for superficial vascular lesions like port wine stains and capillary hemangiomas. Pulsed dye laser PDL is the most common type, targeting blood vessels while sparing surrounding tissues. 3. Sclerotherapy asterisk. Effective for deeper lesions, such as lymphangiomas and venous malformations. Involves injecting sclerosing agents, e.g. ethanol, bleomycin, to induce fibrosis and shrink the lesion. Reduces symptoms like pain, swelling, and functional impairment. For surgical excision asterisk, indicated for large, symptomatic, or recurrent lesions. Ensures complete removal but carries risks like scarring, recurrence, and nerve damage, depending on the location. Prognosis asterisk. Capillary hemangiomas asterisk often regress spontaneously in evolution phase, with good outcomes. Cavernous hemangiomas asterisk may persist, requiring intervention if symptomatic. Lymphangiomas and venous malformations asterisk tend to be persistent. Recurrence is possible after treatment. Early diagnosis and appropriate treatment improve functional and cosmetic outcomes, reducing complications. Thank you for watching Medicam. We hope you found this lecture informative and valuable. If you did, please like, share, and subscribe to support our channel. Don't forget to hit the bell icon to stay updated with our latest lectures on pathology. Your engagement helps us create more quality content. If you have any questions or suggestions, feel free to drop them in the comments section. We'd love to hear from you. Stay tuned for more insightful medical content.